What is HIE and why can it be dangerous for your baby? Want to know what I'm getting at here? Stay with me as I share with you this very important information. Hello, I'm Marcus Boston and I'm a childbirth injury and medical malpractice attorney practicing law here in the state of Maryland, and I would like to quickly talk with you today about some really important information, and this information deals with a medical condition called HIE, and from a medical legal standpoint, why it can be dangerous for your baby. All right, so before I talk to you about HIE, let's go ahead and let's break it down. When I say HIE, what am I talking about? Well, I'm talking about a term called Hypoxic Ischemic Encephalopathy. That's HIE. And to be able to understand what is HIE, let's take the words apart. All right, so remember I said Hypoxic Ischemic Encephalopathy. When we separate them out, look at the word hypoxic or hypoxia for the standpoint of oxygen. So that's a good way to look at hypoxic or hypoxia. Ischemic, that's dealing with blood flow. And so when we have the word encephalopathy, that means an injury to the brain. So if we put the words back together, what we have is a decreased level of blood and oxygen, which can lead to a brain injury. So when I say HIE, or what is HIE or hypoxic ischemic encephalopathy, I'm talking about a decreased level of blood and oxygen, which leads to a brain injury in your baby. All right, now from a medical legal standpoint, why can this be very dangerous for your baby? Well, the best way to understand this is to give you an example of a typical call that we get in my office dealing with this issue. And a lot of times we are contacted by a mother, and this mother will have pretty much had an uneventful pregnancy. And during the pregnancy, you know, like I said, just uneventful, listened to everything that her doctor was telling her, went to all of her appointments, did everything right. And then she presents to the hospital. She presents to the delivery room to go ahead and give birth. And what we can see in some instances is that when the mother's water breaks, the water will contain this substance called Meconium. Now, I've done other videos on Meconium, so I'm not going to get too deep into it, but I'm going to just quickly let you know, Meconium is essentially the baby's stool. So when the water breaks, this substance will be in the fluid, it'll be in the water. And then once the mother is going along with the vaginal delivery, when you have Meconium coupled with other factors, such as on the electronic fetal heart monitor, and I'm going to take a quick break over there. The electronic fetal heart monitor it's a tool that's used in hospitals all across the United States to help doctors and nurses look at and assess the baby's well-being, to be able to determine how well a baby is tolerating a vaginal delivery. So when we have that Meconium present, we've got that electronic fetal heart monitor, it's going, it's running, it's helping the doctors and nurses take a look and be able to determine how well that baby is tolerating the delivery. During the electronic fetal heart monitor tracing, there could be certain things. For example, you could have what we call minimal variability. You could have late decelerations. You could have the baby's heart rate too high for a considerable amount of time, and if that's going on, you're dealing with tachycardia. If the baby's heart rate is too low for a considerable amount of time, you're now in the realm of bradycardia. So if you've got these things going on, coupled with what I said earlier, that Meconium, these signs coming together, they can alert doctors that the baby may not be no longer tolerating that vaginal delivery. When this occurs, if the baby is in distress, now we're going back to that term, HIE. The baby can be in distress because there could be a reduced level of blood and oxygen getting to the baby, which is going to lead to, which can lead to a brain injury. Now, when all of this is going on, doctors and nurses, they have to pay close attention. There are things that they can do with the mother. For example, they can turn mother over. They can give mother oxygen. They can do a both. There's things that they can do to help the baby out and to help mom out. But If some of these intrauterine resuscitation measures, if they are no longer working and the baby, the electronic fetal heart monitor is displaying that the baby is still, not tolerating that vaginal delivery well, doctors must move to an emergency C-section. If they don't move to an emergency C-section in enough time, then the baby can suffer a brain injury. Now, why did I take the time today to talk with you about this really important information? And this video is a lot longer than I normally do, because this topic is very important. And you're probably watching this video because maybe the doctors have talked to you about that term HIE, or you've seen it in your child's medical records. And you remember that there may have been issues happening because you remember when the baby was born, the baby was blue in color, the baby had suffered from seizures, or the baby had to be taken to the NICU. All of these things were going on, and you just got questions now because you're concerned about the challenges that your baby is going to face into the future. Maybe the doctors have given you a subsequent cerebral palsy diagnosis, or maybe your baby is not meeting certain neonatal milestones and you've got questions. If you have all of this going on and you would like to speak with me further, this is what I invite you to do. And remember, taking this next action costs you absolutely nothing. And what is that? To pick up the phone and give me a call. I can be reached at 301-850-4832, or if you prefer, you can send me an email to medicalinjury@bostonlawllc.com. You can also reach me toll-free at 1-833-4BABY-HELP. I answer birth injury and medical malpractice questions just like yours all the time, and I will be happy to take some time and listen to your story. One other thing before I leave, if you're on my website also, be sure to, before you leave, go ahead and request that e-download of our free birth injury book that we have there. It'll give you a lot more information also about this process here in the state of Maryland. All right, that's going to be it for today's quick educational video. Again, I'm Marcus Boston, and I'm one of the childbirth injury and medical malpractice attorneys practicing at Boston Law Group, LLC, here in the state of Maryland. And we will see you next time. Take care, and be sure to enjoy the rest of your day.